Hello and welcome to this class, which is an introduction to patient-reported outcome measures, or PROMs. So in this class, I'll start with obviously sharing what patient-reported outcome measures are, or what PROMs are, and I'll give you several examples. So we'll look at some pain PROMs and some disability PROMs. We'll also look at some PROMs that specifically look at the psychosocial factors of pain. We'll also look at some self-perceived measures of health, specific patient-reported outcome measures that look at that, and visit-specific satisfaction, or basically a way for your patients to give you their satisfaction ratings on seeing you, looking at the clinic and all sorts of things like that, your front desk staff, that kind of thing. We'll also look at some quality of life PROMs and some mental health PROMs. And then I'll specifically look closer at why patient-reported outcome measures are so important, what they do. Obviously, they're very specifically patient-focused, and obviously we're promoting this patient-focused, evidence-based chiropractic care approach. So being able to be patient-focused, one way you can do that is obviously get patients to report on how they perceive their outcomes are going. But it also has value in different areas. It can help literally on decision-making scales, what is best quality care? I mean, if patients absolutely adore chiropractic care for a whole range of different things, that can eventually become a standard. When you're measuring PROMs systematically across thousands and thousands of people. So it's why should we bother with PROMs, basically? They can also have a lot to say about safety, so it's another good thing to use for that. And this whole new movement about value-based care. I'll be talking about that a bit later on as well. And also how you can use patient-reported outcome measures in your office to benchmark yourself, to make sure that you're up to scratch, that you're achieving at least what is known to be the average of the profession. And I'll talk a little bit about how you can do that. And then finally, I want to end up having a little chat about two different organizations or groups, one called Spine IQ and one Care Response, where these are organizations that are trying on a larger scale for chiropractors to collect patient-reported outcome measures and what we can get out of doing that collectively. So that's what we'll be covering in today's class. So these are the key book references for this class. And I've also got quite a long list of publications. I really could give an entire course just talking about patient-reported outcome measures or PROMs. So I've given you a few slides here worth of publications. And again, I've really had to limit myself. So these are some of what I'd consider the key publications relating to patient-reported outcome measures. So what are patient-reported outcome measures? Well, they are tools for you to help understand the health outcomes from the perspective of your customer, from your client, from your patients. So they're increasingly seen as an important source of information to guide quality and safety improvements in healthcare. So not just at a clinical level, like with you and an individual patient, but as we start to gather more and more systematically patient-reported outcome measures from thousands and thousands of our patients and patients of other healthcare providers, you can start to compare these things. So they're really starting to play a bigger role. And there's some shifts within healthcare theories and models, and one of them is towards this value-based care, which I'll talk about a bit later on. So standardized, validated questionnaires that are reliable for things like pain or physical function or symptoms or satisfaction or psychological outcomes or quality of life. These are the kinds of information that we can gather from our patients. Again, I'd like to underline the standardized, reliable, validated questionnaires. If you use standardized, reliable, validated questionnaires, they will also be ones that other health professionals can also use. And then you can start to compare across professions from a patient perspective what works best for the largest number of patients. And honestly, I think this is something where chiropractic can come out literally acing things, because we tend to get very, very high patient satisfaction rates. So I'd really highly recommend that you use patient-reported outcome measures in practice. And again, use standardized, reliable, validated ones. So PROMs or patient-reported outcome measures can be generic, which means that they're specifically applicable to a wide variety of disease states or conditions or health states or populations, or they can be very specific. So there can be a particular patient-reported outcome measure that is for a particular condition or a particular population or particular disease. So they can be very specific for populations or groups. For example, you might have older adults and falls risks. There are specific patient-reported outcome measures or PROMs for them. There can be others for, say, young people with mental health that are specific for that group, right? So just be aware there are hundreds and hundreds and hundreds of different kinds of PROMs out there. So in today's class, I'm literally just introducing you to some of the key ones that are out there. Now, PROMs can be used to measure changes in scores following a healthcare intervention. So, for example, individual patients under your care can be self-reporting how they feel their health is going pre and post a period of your care. And there's a lot of value in that. There's value in you being able to sit and talk to your patient about how their own perceived health-reported outcomes are improving. And again, you might be wondering, well, which ones should I use? Well, ask your patient what matters to them. If pain matters to them, measure pain. If disability matters most to them, measure disability. If there's a specific symptom, do a MIMOP. If their mental health is most important, measure mental health. If it's quality of life, measure quality of life. If they're not really too sure, well, go with an overall health measure or an overall quality of life measure. So you can use a lot of logic here and go with using patient-reported outcome measures that suit you and your patient. My point is that it's not just about the clinical encounter, because patient-reported outcome measures can also be used on a larger scale. They're increasingly used as quality improvement tools, where PROMS data can be used to monitor outcomes of individual care, but thousands of individual care encounters, and feed into these larger clinical registries that can assist us in identifying effective healthcare practices and benchmarking performance of our healthcare providers. It really can make a difference in the long run. And that's why I'm hoping and encouraging you to use PROMs in practice. So again, the whole point of all of this is this patient-focused evidence-based practice. It's the model that we're promoting that you practice in this model. So sharing the relevant science, and we've got lots of other classes on how to do that, sharing your clinical experience and using your clinical experience and judgment to elicit from the patient what's important to them, so that that encounter is very patient-focused, and it's about the patient's values and their preferences and how they feel their healthcare is improving or not. And it's specifically for this patient value, patient preference pillar, one of the three equally important pillars, that I'm encouraging you to use patient-reported outcome measures. But I want you to use standardized, validated, reliable ones. Why standardized? Because if you use standardized ones, we can start comparing the outcomes that our patients feel with chiropractic care with outcomes from physiotherapy care or from acupuncture care or from drugs and surgery type care. With standardized forms, you can use it across professions. There's a lot more value in that. Why use validated questionnaires? Because validated questionnaires literally means that they're actually recording what they're supposed to be recording. So if it's about mental health, the questionnaire has been shown to truly reflect mental health. Or if it's about pain, the questionnaire has been shown to truly reflect aspects of pain. Why reliable? Well, the reliability of a questionnaire is about if you use that measure once a week and you had no intervention and nothing else influenced the outcomes of that measure, it should give you the same reading. You don't want it randomly to give you different readings because of the way the questions can be ambiguous. So you don't want a person to fill it in one day and interpret it one way and then fill it in another day and interpret it another way. So again, they run reliability studies to make sure that these questionnaires, these patient-reported outcome measures, these PROMs, are reliable. If 2 weeks apart, if you haven't done anything differently, you should get exactly the same reading. So it's so important that they're validated, that they're standardized, and that they are reliable. And if you do that in practice, you are definitely making sure that you are taking care of this patient pillar, the patient values and their preferences. And you can use this as a tool in practice to make sure that you keep your focus on what matters most to your patients. And I want you to think about these patient-reported outcome measures on 3 different levels. The clinical encounter level, that's you and your patient. The multi-practice or professional benchmarking level, so now we're talking the whole chiropractic profession here, or multi-practices, but bigger than just you and your clients. And then the 3rd level I want you to think of is this policy and decision-making level. This is government level. This is WHO level. This is where big decisions are made about impacts of healthcare. And again, these patient-reported outcome measures can add value to all three of those levels. So I'm assuming it's reasonably obvious now that this clinical encounter level, these patient-reported outcome measures can help you understand and evaluate and enhance your interactions with your clients. It can help you in your decision-making. When you're making care plans for an individual, you can find out what matters most to them, where they're at. And this is where you can literally ask them what matters most to them. Why are they there to see you? And then make sure that you follow up on those issues. You might want to have some standard forms for everybody, like quality of life or their own ratings of their own health, for example. You might want to do that on everybody. You might want to do a visit satisfaction rating on every 6 visits or so that you get an idea of certain things that you want. But even the fact that you're asking them to fill in these particular things shows that you care about what they think about how satisfied they are being in your clinic, what their quality of life is. So you asking them to fill in certain forms shows that you care about those aspects for them. And then you can ask them if there's any other specific issues or health concerns that they have that you also could monitor with patient-reported outcome measures. Now, the multi-practice or professional benchmarking level, this brings it up to the whole chiropractic level because these patient-reported outcome measures can also be used to understand factors that influence the profession itself. So at this level, it can be used along with other clinical research outcome measures. It can be used in clinical decision making. So we can start to identify what matters most to patients alongside other objective measures of health or objective measures of mental health or, EEG data or heart rate variability data. But taking into account what patients report themselves is an important part of outcomes. So if we're starting to look at guidelines for chiropractic care, looking at what patients tell us is important to them, and when you've got thousands and thousands and thousands of these data sets, you can start to see how that would play a role for the profession in making decisions about clinical encounters and the value of chiropractic care. You can also use this to benchmark yourself because if you know what the average results are, if you know that on average people that see chiropractors would drop their pain rating scores by 3 points, and if you're not achieving that on average in your patients, then maybe you need to consider doing some seminars. So it's a great way of knowing how do your results with your patients stack up against the profession on average? And are you achieving an average result? Maybe you want to set yourself much higher than that. Maybe you want an excellent result. Maybe you want above average, whatever. But you get the opportunity to see how you and your data with your patients stack up against the profession in general, in your country, in your region, in your state. And then, of course, there's this third level, this policy and decision-making level, where patient-reported outcome measures can be used by decision makers to establish and evaluate policies designed to benefit whole populations. So you can look at trends in populations, you can identify factors that are associated with value in healthcare that can inform payment models, and it can inform quality improvement activities at a systems level, such as standard setting, or adherence to clinical guidelines and performance measures across healthcare organizations. If it's established from large patient-reported outcome measures, groups, lots of professional measures, data from various different groups, that patients are far more satisfied with chiropractic care and they report their outcomes and improvements far better under chiropractic care than other kinds of care for different kinds of conditions, this can become part of that decision-making, policy-making level where they create these guidelines and when they create these standards. And that's where, again, these patient-reported outcome measures can be very, very valuable for us as chiropractors. So I'm going to move on now and discuss a few of the pain and disability patient-reported outcome measures. But before I do that, just pause, make sure that you test yourself and make sure you're picking up on the key concepts that we're covering.